Hello, everyone, and welcome back to the Patient First podcast. I'm your host, Dr. Bryan Laskin, and I'm so excited, of course, that you are here. And we now are the number one, well, the only, the Editor's Choice Award winner for dentalpodcast.org. And thank you for that honor from Dental Woo, Dent Woo, and dentalpodcast.org. We are the Editor's Choice, meaning that not the most popular, but the editors liked us the most. So thank you very much for that. And we're trying to bring as much value as we can to the dental community, including, of course, all of our fantastic patients. And as you can probably tell if you listen to this podcast at all, I like to pay attention to what's going on in the dental industry and then also how dentists are looking at our industry, which is incredibly different than how patients view our industry. And that's what I'm really trying to do here is bridge what I call the great disconnect between dental patients and dental providers, because I feel like we look at our beautiful industry so differently. Let me rephrase that. I know that we look at the industry completely differently. It's the subject of my book, The Patient First Manifesto. Oop, there it is. If you don't have a copy, I'm sure there's a link around here, but why this happens, and but the manifestations of it keep continuing. And there were two different things that I saw on a social media platform. I don't want to plug it because they're kind of mendacious, but on a social media platform that together I think says a lot about where we are as an industry. The first was a poll talking about why dentists care so much about profitability, specifically EBITDA, and why it's being talked about so much in the industry. Like what they were asking basically is, why does everybody just focus on profitability right now when people like myself talking to the industry? Well, number one, I think that was the first thing. And the second was a survey that said, what is the holdback on you looking at buying a CBCT scan? So a 3D imaging where you can see the whole jaw at once. We've had it in my practice for about 12 years. And so the question, which I thought was very interesting, is why aren't you investing in a CBCT scan? So, and I think, as you'll see, these two are related. I believe strongly that the reason why people like myself talk about EBITDA is because of the change that's going on that's voracious within the dental industry, which is the influx of private equity money into dentistry. And as you bring in private equity money, and there's a lot more business people who are coming into the industry, meaning people that aren't clinicians who are running dental practices and basically investing in dentistry, then EBITDA gets discussed more. And I went to a group practice meeting a couple weeks ago. As I've been going to tons of dental meetings lately. Holy man, there's a lot of this is dental meeting season, baby. It's hot right now, and so there's just so many meetings. And this one that I went to, it was very interesting because at this group practice meeting, I was one of, if there were 5 dentists there, I would be surprised. Hundreds of people, and maybe 4 dentists. I think I might have met 2 while I was there. I mean, there weren't many dentists at this meeting. And the dentists that were there were in they were leadership team. They were on a leadership team of a group practice where it was being run by business people. So I was and I would put myself, because I used to have that role, thankfully not anymore. And there's nothing wrong with that. I'm just not someone who should be on a leadership team in a secondary position because it's just goes against my nature. However, I digress. So, but what was interesting is I was talking to some of the vendors, because there's a lot of vendors who service the group practice segment of our industry, of the dental industry, and they said something that I didn't really think of before that is very much true. They said that at a normal dental meeting, like if you go to the Chicago Midwinters coming up, first time since graduating from dental school, and I won't be going there because I have another opportunity. But so Chicago Midwinter, the Greater New York, the Yankee meeting, all great meetings, all dental meetings. If you go to one of those traditional dental meetings, what you'll find is a bunch of dentists learning about clinical dentistry, and every once in a while, a dentist might go to learn something about business. If you go to a group practice meeting, it's a bunch of business people who might every once in a while try to learn something about dentistry. And so there's this bifurcation, I believe, in our industry. Again, I mean, just like the patients view dentistry different than dental providers, the business people in dentistry view our industry differently than we do, and they're bringing with them this, EBITDA, P&Ls are important. Patient experience actually, frankly, is matters more to them. So I'm not saying this negatively to the business people entering our industry. I feel like at the end of the day, if you're running a business, there's a customer or a patient at the end that has to have positive service if your business is going to continue. So, unlike some other forces in our industry, dental insurance, for example, is they're trying to reduce the costs and not necessarily for the patients. They're trying to increase their profitability as a middle layer in the industry. I do believe that the DSOs, the group practices, have a shared interest in elevating patient care. Now, is it completely one to one with what a dental professional would want to see? Probably not. But frankly, I've visited thousands of dental practices, and I don't think that having a layer of validation in there is necessarily bad. Now, of course, this is a hot topic, very, very debatable. So please debate with me. If you have comments, suggestions, I'd love to see them. I love when people reach out to me, and I'd love to answer your questions. But my point here is that EBITDA, the discussions about profitability, are the byproduct of a couple forces coming together. Number one, hugely the corporations, the private equity coming in and investing into our industry has changed the discussion of how we look at our practices to include profitability. The other side, which we've talked on this podcast quite a bit about, is the increases in wages, the increases in costs, inflation, and the decrease in reimbursements. Again, see above dental insurance, right? Decreasing reimbursement, increasing expenses equals squish profitability. And guess what? Then we talk about it because it's problematic. So on the one hand, there's sort of a problem and opportunity depending on how you look at it. Like most things, right? Every crisis, like the Japanese letter for crisis and opportunity, is the same. And I would put that when it comes to corporate dentistry, uh, and then private equity money coming into the space. And then you also have the which there's no great opportunity with this. Well, maybe there is. But right now I can't see it. Is the squeezing of profits in dentistry. So we're talking about that, right? So that's number one, discussing EBITDA. That and hopefully, again, I'd love to hear your discussions about that. It's a very hot topic. And I think it's important. I think it is important in any industry. Look, I like to say you can't provide your best care if you don't get your house in order. Got to get your financial house in order for your practice so that you can put patients first. Because that survey on the CBCT scan, the number one reason by far, why do you think dentists are reluctant to invest in a CBT scan? 89% said it was due to cost, the cost of the machine. I think that is completely messed up. I mean, and now not messed up. It's unfortunate. That's really what it is. It's unfortunate that we are at a spot, for having a CBCT scan 12 years ago in my practice. Uh, I feel like it is the only reason why it's not a standard of care, small s standard, as we talk a lot about ANSI standards on this podcast, but um, the small s standard of care is because it's not used more ubiquitously. There's no doubt it provides higher quality care. Period. Full stop. End of story. Nobody on this, I don't think on this survey said it's not better. Okay. The two major reasons, number one, again, by far and away the biggest, but at 89%, almost 90% was cost. The distant second was the concern of liability, meaning if that you wouldn't catch something on the scan, then therefore you would be held liable for it. I mean, that's also backward, in my opinion. If we're putting patients first, right? If you're here listening and cost is an issue and the liability of being able to detect something, but you don't actually catch it is an issue, is that putting patients first? The answer is absolutely not. And the reason why I got a CBT scan in my office was, I'll tell you the story. I received an implant from an oral surgeon that was horrifically placed for tooth number 18. It was distal and distal distally placed, mesially inclined. And the note from the oral surgeon said, place the implant where there was bone. If you cannot restore, let me know and I'll take it out and replace it. Okay. So, first of all, if you can take it out and replace it, there's bone where you're going to replace it, right? So you screwed up. Now they put that monkey on my back to decide whether or not to restore this implant in a way less than idealized position or to take it out and replace it, right? And my decision was to get a CBT scan so this never happened to a patient in my practice again. That oral surgeon had a CT scan in their practice, didn't use it. And that CT scan, I found out later, the software hadn't been updated in 3 years. And they had one CT scan for 6 locations. Doesn't make any sense, right? After having a CT scan, when we first got a CT scan, we're like, oh, when are we going to use this thing? The answer is all of the time because you get a lot more data. Now, I'm not here to sell you a CT scan. I'm telling you that having the cost be a barrier, which it was for me at the time, it was for me at the time. So I said to myself, Bryan, this CBCT scan costs $100,000, which it did at the time. And I don't do that much endo. I don't place implants. I don't even do oral surgery. So where is the ROI going to come from with the CT scan? And I said, well, unless I place implants, do oral surgery in my office, or do a ton of endo in the office, I'm not going to get an ROI. So you know what I did? I called up a friend of mine who went to the oral surgery program in town. I said, hey, want to come to my office and start placing implants, doing sedation, doing what you do here, and I'll get a CT scan and we'll do it the best way possible. And he said, Bryan, sounds like a plan. And so I invested not only the $100,000 in the CT scan, but another $100,000 in all the, I just gave him a checkbook. I said, buy whatever you need to deliver the best possible care, to do implants, sedation, all the things that you do wonderfully where you're going now. Just come to my practice a couple times a month and we'll do it here. That's how I got a CBCT scan, right? So what I did is I took that problem, which 90% roughly of dentists are looking at with a CT scan, the cost, and I turned it into an opportunity. I said, how am I going to get an ROI on it? Because I don't want the patients in my office to not have the best care possible, period. Can't tell you how you can turn that in your practice, but I'm just telling you the kind of situation that I look at and I say, if the cost is the barrier, and or if you're worried about the liability, hell, you can send out the scan to be reviewed by somebody else if you don't want to review it yourself, which we did along for quite a while until I got comfortable reading them myself. And so we did that for years and still do if there's a question. My point is, let's not let the cost be a barrier. And these two are linked. Why? Because if you're complaining about profitability and EBITDA and you don't know how to pay for the CT scan, get the financial house in order for your practice first. If you don't know where to start, contact me at Upgrade Dental. Holy man, we have great, my own course, the Insanely Productive Dentist, can train you to have more EBITDA than you probably can dream of. So investing in CT scan, frankly, I could have bought the CT scan without bringing in an oral surgeon. I just like to have a positive ROI on pretty much everything I do. So I wanted to figure that out. And by the way, saw the opportunity to start doing things a better way in the practice versus sending my patient to an oral surgeon who was a fantastic oral surgeon, just didn't invest in the right technology that was available at the time 12 years ago, right? So if you don't have a CT scan and it's due to cost, hopefully this has helped you. If you're a patient, you're looking to have an implant done, I would tell any patient getting an implant, get a CT scan. Period. End of story. Even endo. I mean, I've seen so much stuff, and I've detailed some of that on this podcast. So, I mean, there's just a lot more information. It's 3D versus 2D. Period. End of story. Right? Would you do fillings without an X-ray? No. Would you do an implant without a CT scan? I won't, and I don't even place implants, but I've restored a whole heck of a lot of them, and some of them, the ones that are placed with the CT scan, typically speaking, are much better. I've actually done the test where I hand placed an implant versus where there's bone and kind of figured where it was going to be versus with like the CAD CAM systems, you can design the crown first. And the difference of where the implant is placed is huge. Even on a simple lower premolar, If you place, I'm going to go over that again a little slower. If you use a CAD CAM system with a CT scan, right? You can actually create the crown first, and then the software will place the implant in the idealized position where you're going to restore that tooth versus placing the implant first and then restoring it. In my experience, it's been completely different where that implant is placed. Going crown down makes all the sense in the world. And you can't do it without both a CT scan and a CAD CAM system. So, can you do it? Can you place an implant and restore it without a CT scan, without a CAD CAM system? Absolutely. Would I want to do it that way? Absolutely not. Now, I know it costs more. There's an investment on the front end, but we're talking if you're doing implants, if you're doing endo, it's not the cost of these systems has not even gone up from when I bought them. In fact, there's a lot less expensive ones. So that's my plea to the 90% of dentists who responded saying that cost was an issue. Again, if you have questions, comments, if you find the EBITDA somewhere else in the practice, because you can't provide. I mean, if you don't have the financial house in order in your practice, you can't provide the best for our patients. So that's my 2 cents of EBITDA for you this week on the Patient First podcast. And of course, like always, I look forward to seeing you right here next week.